A study conducted in the Ashanti region among persons 45 years and above revealed the growing spate of dementia among the populace. Of a sample of 800 individuals randomly selected, 23% of the males had dementia and more prevalent among the women at almost 25%. The study was conducted by a team of researchers led by a Ghanaian lecturer in adult nursing at the University of Huddersfield in the UK, Mr. Precious Adade Duodu.
The study found that individuals who were younger or had advanced formal education, especially men, had the lowest tendency of dementia, as increased brain activity due to learning has been identified as a protective factor. The wealth index of households was also a factor, as men with low wealth index stood a greater risk. Debriefing the participants in the local dialect about the findings, the principal investigator, Mr. Precious Adade Duodu, also educated them about some misconceptions of dementia from the social, cultural, and religious perspectives. Stigma against patients and other caregivers was also addressed. But how well understood was the findings and education given the participants?
Educators
talked about the enormous impact of the research findings for dementia care.
Because of the aging population, now we've seen nursing homes and then few caregivers going run either to people, the patient themselves, or having a group management. I think it's something that is coming up, and the policymakers need to have a second look at it as to how we can regulate and monitor.
The Regional Director of Health Services in the Ashanti region, Dr. Fred Adomako Boateng, said the time was ripe for a review in policy about how healthcare services are delivered to ensure that no one is left behind.
Something that is giving us a lot of food for thought. Most of our service delivery is looking at disease cure. And therefore, because of the way that we have designed the service to be disease cure, we have maybe caught in this arena whereby more thought have not gone into, look, we are becoming an aging population. There are particular factors or, let's say, disability associated with aging.
From the perspectives of lawmakers, the chair of the Population Caucus and Deputy Minority Leader in Parliament, Ms. Patricia Appiagyei, said the social protection law does not comprehensively address the health needs of the aged.
The social protection law has been passed, all right, but I believe that we also need to look at specific issues like the aged, how as a country we will be taking care of the aged, because we have had a rude realization that people can live beyond 20, 30 years after their pension. The challenge with the private members' bill is the fact that these bills have to be sponsored, and lack of adequate financing may not see us through some of the bills that we would want to undertake.
The research, which has so far had 3 peer-reviewed publications, was funded by the School of Human and Health Sciences of the University of Huddersfield in the UK, which looked at the associated factors in dementia care. It was disseminated with seed funding from the School of Rapid Research Funds and in collaboration with the Kwame Nkrumah University of Science and Technology. Sarah for GBC News, Kumasi.